have every belief that before this century is over, people will talk about drug prohibition the way we talk about alcohol prohibition, a stupid, failed experience that should have never been started. I know that.
To be honest, I don't know that much about alcohol prohibition, but what I do know is that for all the right reasons, a lot of women particularly got on the streets and campaigned for prohibiting what for them was clearly a very dangerous drug. 13 years later, those same women were back on the streets demanding let's stop.
They say that, insanity is doing the same thing over and over again, expecting a different result. We've been pursuing this drug war now for almost half a century, and it hasn't produced a different result, so I'm clear the problem is us and not the drugs.
We have reams of evidence showing what sorts of programs and interventions and services are effective in protecting the health of individuals and also the health of communities more broadly. But often those things are either verboten by governments or vastly underfunded in relation to all sorts of things that are not well supported by the evidence, such as many of the more punitive law enforcement sorts of approaches. And in fact, some of those approaches, the evidence shows, are actually counterproductive and damaging to both human rights and the health of individuals and the public.
So about 20-25% of the people behind bars in our country really have mental health problems. They should be getting mental health care, but what we offer them is a prison cell. Another 25% of the people in prison are there because they have drug problems. Instead of giving them drug treatment, we offer them a prison cell.
One that I really like to propose when I talk to people who aren't involved in the drugs field is to say, well, if we have people who are diabetic and they're going to eat chocolate and they know it's not going to be good for them, but they're going to eat it anyway, are we going to send them to prison because they've eaten chocolate?
What do? You stand up and say, yeah, we're really behind prohibition because it creates crime and gives an enormous trade to the mafia and drives HIV and ruins inner cities and doubles the prison population and creates 95% of street prostitution. Not a good one to stand up and wave a flag about.
The major challenge for Thailand will be, and not just for Thailand, but for Asia as a whole, is to make sure that their drug control policies and the objectives of the drug control policies are in line with their public health policies and their public health objectives.
And another biggest challenge is drug policies. Drug policies which put people in prisons, which put people without help and assistance, and also because of which societies are stigmatizing and discriminating drug users.
And if it then comes to dealing with people who use drugs in the drug policy story, first you have to already get them on the table to give them a voice, because also the having of no voice is one of the signs that there could be something wrong with your human rights, if people don't allow you to speak.
Almost everywhere, the poor are disproportionately affected by punitive drug policies. Minority communities, whether they're ethnic minorities or racial minorities or religious minorities, are also overrepresented in the people who are negatively impacted by punitive drug policies. So that's consistent no matter where you go.
We've had needle exchange programs for 20-plus years in Canada that enjoy widespread public support. So I think people get the basic concept that this is something that needs to be dealt with as a health issue. And I think our federal government that seems to be so insistent on yet more of a law and order approach and abandoning harm reduction, I think they're actually losing favor with the Canadian public on that point.
I think that it's absolutely unconscionable that all these years into the HIV/AIDS epidemic that we still don't have a national policy of providing funding for needle exchange, which we know works and doesn't increase substance abuse.
With alcohol prohibition, it was just one country. What we've done is recapitulated that on the global stage. I mean, it's madness, madness.
There have been 14 states in the United States that have passed laws to allow for medical access to marijuana. And these are through initiatives that were approved by the voters or through legislation that was approved by state legislatures. Our federal government still refuses to allow those states to implement the law that their people have voted for.
America's currently in an election process, and both candidates have made statements about drugs and about drug users that can be considered as a potential new direction for the U.S. involvement in drug control internationally and within the UN.
All drug policy is based on myth, faith, and dogma. And so are all the kind of reasons why people believe that they can't get out of it. It's the same thing. So the evidence doesn't engage there. My guess is that it's just stuck because it's stuck. You know, it's kind of the time that we're in is where drug policy is stuck.
Our federal law requires that a person who's convicted of selling 5 grams of crack cocaine must get 5 years in prison. Now, you know, regardless of what you think about the morality or whatever of this issue, from a practical point of view, 5 grams of crack isn't even worth $1,000 on the street in any city in the United States. It costs $30,000 a year to keep a person in federal prison, which means that as a policy, we're willing to spend $150,000 to lock somebody up for a $1,000 crime, but we're not willing to give them $10,000 to go to college or $20,000 for federal housing or anything else that would actually allow them to have a more productive life. I think that that is like insanity.
The other thing for us, I think, is in terms of not pushing a pro-drug agenda, is that we've got a lot of people who support us, and increasingly there will be a lot of people who support reform who don't use and aren't interested in other people using.
But I believe in consensus building, I really do, and I believe that that's, you know, it's a slower process, but I actually think in the long run it's a better process because it means that you have group ownership of what you're doing.
So we talk about regulation now. So the end game is the legal regulation and control of currently prohibited substances. The end of prohibition, its replacement with an effective, just and humane system. Another way of putting it would be the bringing about of legally regulated drug markets for non-medical drug use. So pick whichever one of those resonates most for you. That's what we're after. And we think that could happen around 2020.